I'm so excited to see you this time because it is a great opportunity indeed for me to see you once again and to share some health tips with you. Thank you for your time and for the sharing comments and some of the questions that you have been asking. I'm so grateful, and I know all my videos are reaching your needs. Thank you. Today, I'm going to be talking about um, a kind of a chronic condition that most people think is nothing. Most people don't even care in order to know more about it. And that is why it is a great opportunity for you to, listen, watch, and learn because it is an educational health tip, which is diabetes. Okay, this diabetes is a chronic condition where the body either doesn't produce enough insulin or doesn't use it effectively. If this body does not use it in a good way or does not even produce this insulin, it will now result in what we call this diabetes. As I said earlier, is a chronic condition where the body either doesn't produce enough insulin or doesn't even use it effectively, leading to elevated blood levels. So the blood level will now shoot up, which will now result to diabetes. So today I will talk about a broad, you understand, that is the overview of this diabetes because we have uh, some types of diabetes, which we have type 1 and type 2 diabetes. But today I will just talk about the overview of it. I will not just go to the either of it. So, what causes this diabetes? Because most people have been asking me, and that is why I want to use this opportunity in order to highlight more about this. So, what can cause this diabetes? Number one is type 1 diabetes, which we call it the autoimmune destruction uh, diabetes. Because this type 1 diabetes is autoimmune destruction of insulin producing cells in the pancreas. Okay, and the type 2 diabetes, which is the second um, causes of this diabetes, is the type 2 diabetes. What happens there is the insulin resistance because the insulin resists. Okay, insulin resistance due to the genetic factors like the obesity and unhealthy lifestyle result to this diabetes type 2. Okay, then what causes this this diabetes again is the gestational diabetes. This occurs during pregnancy due to the hormonal changes. Okay, because the hormones change, so it will now result towards we call diabetes. And there are some other causes like the pancreatic damage, some certain medications, or some genetic disorders can actually cause this diabetes. Now, um, what will be the sign and symptoms of this diabetes? Because it is good for you to know this in case presently you are experiencing that problem, for you to take a good um, action on it. So, what could be the sign and symptoms? Number one is the frequent urination. Then, secondly, is the excessive thirst because you'll be thirsty, looking for water all the time. And the next one is the unexplained weight loss. You just be losing some weight without a concrete reason. And fatigue, blood vision, slow healing wound, or infection. Okay, those are the signs and symptoms of all this diabetes. So, once you are having these signs and symptoms, so you are at high risk of developing this. Not necessarily be diabetes, but it could be something different. But today, in particular, I'm talking about the diabetes. Then what could be the treatment of this diabetes? Okay, number one, we have medication, because we have some medication like some of the insulin therapy, the type 1 or the type 2. We use some insulin injection in terms of that. Then we have some of the oral medication like the metformin and some of the clamide. It helps in reducing the level of the blood. Then we have some life changes that actually helps in terms of treating these um, diabetes, such as the healthy diet. Some of the food that I have, low sugar and then high fiber, and then you have to be regularly exercising yourself in order to stabilize some of the blood um, sugar. Okay, then always monitoring regular blood sugar checks and some of the HbA1c tests in order to maintain the level of your sugar. Then what could be the prevention measures? Okay, the preventive measures of this diabetes. Because maintaining a healthy weight, that is the number one that you have to be doing, maintaining a healthy weight, checking your weight. If you are overweight, you need to follow the due process in order to maintain the stabilize, you know, the average weight, the average level of the weight. And there are some advices to give, they can give. Then the next one that I have is eat always a balanced diet. Okay, always eating a balanced diet, because limiting some of the processed food and sugary drinks will actually help. Once you are taking all those foods, it will actually shoot up the blood level or blood sugar. And I'll also avoid some of the smoking and excessive alcohol consumption. Regular health checks up if you have risk factor, because having this risk factor, you are at stake, or at in a level that if care is not taken, you will develop this problem. Then today I have some advice in order to share with you. I will not just leave you like that, okay? But number one advice is education. Learn about diabetes management and complications like heart disease, nerve damage. It will help you, because all these heart disease, they have a linkage within them. Some of the nerves damages can actually help a lot when you have a clearer. But no problem. I'll be helping you people, sending some of the health tips on this heart disease, nerve damage, and so on and so forth. Then always stick to your treatment plan and monitor the blood sugar regularly, please. If you know that you have this problem, always check the level of your sugar. Then join diabetes support groups for motivation and shared experience. But remember, having diabetes does not mean that your end has come. You understand? You still have time. I still have enough, ways in order to treat this diabetes. Just feel free, share your comments, share your views, and you can put everything or any question that you have at the comment section. Thank you very much.